Good evening. I want to welcome you to Shrewsbury High School tonight for our panel discussion on the opioid epidemic. That's not only a significant contributor or a situation in our community, but also our state and also our country. Tonight we have a panel of experts before us that are going to share their experiences from the state, regional, and local levels around what they're seeing. We also have people that have had their families impacted by this epidemic and going to share some of the things that they've seen in their lives. I want to thank the Shrewsbury Coalition for Addiction Prevention and Education. It's basically a group of representatives that have come together to try and address addiction needs within our community. They've helped put together this panel. That's a result of their work. I also want to welcome members of the school committee, Central Office Administration from Shrewsbury Public Schools, Board of Selectmen, and also our friends from Westboro from the town side who are here to observe with the hopes of putting something on in their community as well. We're very fortunate to have these panel members here, and at the end of our discussion, we'll open the floor for question and answers. There's 2 mics on each aisle that we can come down to. If you have a question for the panel or myself, I'm happy to share that with you. Senator Moore is actually running a bit late. He had to attend a meeting in Northbridge. He'll be here momentarily. But I'll want to first introduce members of our panel. To my right and your left, District Attorney Joseph Early. District Attorney Early is serving his 3rd term as Worcester County District Attorney. Mr. Early works with the law enforcement agencies in over 60 communities that make up the Middle District. He formed the Central Mass Opioid Task Force to help the people of the district deal with the opioid abuse. Mr. Early's office was recently awarded a $400,000 federal grant that is funding research and data collection. The information will help agencies target their response to this crisis. And Mr. Early's office also won a state grant of about $100,000 to fund a pilot program for intervening with the opioid addicts at the point of overdose. Mr. Early lives in Worcester with his wife Judy and their 5 children. Representative Hannah Kane. Hannah serves as a state representative for the 11th Worcester District, representing the towns of Shrewsbury and Westboro, precincts 4 and 5. Hannah graduated from Boston University School of Management in 1993. She has significant experience both in the public and private sector and is deeply committed to public service. Hannah has served as an elected town meeting member for 14 years, a member of the Shrewsbury Finance Committee, president of the Shrewsbury Public Schools Foundation, president of Floral Street PTO, a parent member of the Oak Middle School Council. Hannah is also a member of the Shrewsbury Coalition for Addiction Prevention and Education and a board member for SYFS, and hosts a charity golf tournament benefiting SYFS, St. Anne's Human Services, and the Westboro Food Pantry. Hannah also serves as a member on the Joint Committee of Public Health, the Joint Committee on Transportation, the House Committee on Personnel and Administration, and the House Committee on Redistricting. Hannah is a member of the Central Mass Opioid Task Force, a state director for the National Women in Government Foundation, where she's a member of the Mental Health and Substance Abuse Task Force. Hannah and her husband Jim have lived in Shrewsbury for 19 years, have 3 children, Madison, Caitlin, and Patrick, and they all attend Shrewsbury Public Schools. Cassandra Andersen. Cassandra is a Regional Behavioral Health Programs Manager for Central Massachusetts Regional Public Health Alliance and has been with the City of Worcester, Massachusetts Division of Public Health for over 3 years. Before joining the City of Worcester, she worked in diverse settings in the Worcester region, including management of youth programming, providing technical assistance on developing healthy communities, and ensuring community engagement and community-based participatory research. She is also responsible for overseeing the implementation of grants and initiatives to improve mental health and reduce substance abuse and misuse across the Central Mass Regional Public Health Alliance. Engaging academic, community, and municipal partners in collaborative initiatives to implement evidence-based strategies and produce innovative research is an essential component of her work. Cassandra received her BS from Bachelor of Science from WPI in Environmental Policy and Development. Chuck Faris. Chuck Faris is President and CEO of Spectrum Health Systems. With more than 45 years experience in the field of addiction treatment, Mr. Faris is regarded one of the most authoritative experts in the administration of behavioral health care programming. Spectrum is the largest and most comprehensive addiction treatment organization in Massachusetts. Spectrum also provides treatment services in 5 other states across the country. His appointments have included chairman of the Central Mass Substance Abuse Association, the president of the Alcohol and Drug Abuse Association of Massachusetts. He is also the recipient of the National Niswander Dole Award for Outstanding Contribution to Methadone Treatment, the Francis O'Brien Award for Leadership in the Field of Substance Abuse, the National Council for Behavioral Health 2015 Visionary Leadership Award, and the Worcester Business Journal's 2012 Nonprofit Business Leader of the Year. Lieutenant James Lonchiadis. Lieutenant Lonchiadis is a 20-year veteran of the Shrewsbury Police Department. He has worked his way through the ranks, serving as patrolman, detective, sergeant, and now lieutenant. He's also a lieutenant colonel in the Air National Guard, and he flies Black Hawk helicopters, one of those things you might not know about Jim. And he's also been deployed to Iraq twice. Jim holds a master's degree in criminal justice. Joey Cameron, originally from Southborough, Massachusetts. Joey's been working in the treatment field for several years now, having personally dealt with and overcoming addiction. He possesses a unique knowledge and insight into how recovery process works for young adults and their families. Joey started his undergraduate studies at Clemson University and now earned a BS in marketing from Lynn University. Excuse me. He is actively involved within a local recovery community in South Florida and has dedicated a significant amount of time of helping young people who are suffering from addiction. Joey does extensive outreach work in his home state of Massachusetts, as well as across the nation. I want to thank him for flying in from Florida today, so thanks to Joey. And Dr. Christine McGuinn. Christine has lived in Shrewsbury for 20 years. She's been an active parent within the Shrewsbury Public School community. Christine holds a doctorate in psychology from the University of Connecticut and is a professor of psychology and served that role around local colleges and universities. She's currently teaching at Worcester State University. Christine is the mother of Julia, Joe, and Mary Grace, and all three attended Shrewsbury High School. So, nice round of applause and welcome for our panel. As a principal of the high school and a member of our community, I think it's important that I stand before you and tell you some of the things that I've seen and some of the issues that we've seen in our community. I'm a very proud person. I'm proud of our schools. I'm proud of our students. I'm proud of the community in general. But one of the things that I've witnessed is the scourge of heroin and the scourge of opiate addiction within our community. And the purpose of this meeting, quite frankly, is bring attention to parents and community members around what's happening in our community. Many people don't believe it's happening here or it's swept under the rug, but the reality is it's here. There are people that live next door to you. There are people that you work with. There are children of your friends that are addicted or on their way to being addicted. It's important that you know some of the things that we see as sometimes the first responders, so to speak, on some of the behavioral things that we see here at the secondary school or at the high school. This addiction is indiscriminate. It doesn't matter what race you are, what nationality you are, what religion you study, what ethnicity you are. When it gets you, it's going to get you. And it's going to get its claws in you, and it's very, very difficult. And I think Joey will share with you some of the difficulties he's encountered. But from the students that I've seen that came through Shrewsbury High School, it really is a troubling, troubling situation. So, what kind of students are at risk? What type of behaviors have we seen? From my perspective, and I say this at probably every freshman orientation, injuries, sports injuries, and the medication that's given related to sports injuries or surgeries such as wisdom teeth or appendix, escape from feelings including trauma, family dysfunction, anxiety. A big one in high school is also acceptance and self-esteem. A lot of kids turn to do what they do because of the fact they want to feel like they fit in. And in this case, when you use these type of drugs, you're hooked, and that's the problem that we see. Another big thing we have to think about, or another thing that we see here, is the ease of access. Many people have these prescription medications with their own medicine cabinets. So, I've been in Shrewsbury for 11 years. Here's the numbers. I've been in Shrewsbury for 11 years, principal for 5 years. During that time, of my 11 years, I've known 33 students who've graduated from here who are addicted to heroin. 7 of those students, I've attended their funeral. For parents, I want to tell you this. I tell parents this all the time. If you think something is wrong with your son or daughter, you're right. If you suspect something that you think is off, a change in behavior, a change in friends, radical change, something is wrong. Believe your intuition. It's typically right. I'll share with you a story at the end around a mother's intuition. But I first want to bring this back a little bit to talk about a little bit of our efforts around the state and region. And I want to ask, our focus is to arm you with information tonight, but I want to ask my first question to District Attorney Early. And I'm wondering, Mr. Early, can you tell us what you've seen across Worcester County? And can you provide us an overview of what you're doing in your role as District Attorney?
Sure. First of all, thanks, Principal Bazydio, for holding this community forum. I got to tell you, this is the most well-attended forum that I've seen in central Massachusetts. Applaud you guys for coming out. Oh boy, a couple things you touched on. Number one, there are no boundaries. It doesn't happen to the poor, middle class, or just the rich exclusively. It happens to everyone. Number two, there are no geographical boundaries. We just had a group of our people attend the Prescription Drug Abuse, Opioid, and Heroin Summit. They added the word heroin this year down in Atlanta, Georgia, where we learned to listen. We listened to the best experts in the world tell us what was going on, what was working for them, and how we could fight the problem. We had 111 overdose deaths last year in central Massachusetts, 111. For the last 3 years, we've had triple figures. Compared to 1999, the numbers have quadrupled. What I'm telling our ADAs is to show compassion, stay within the law. One of the best things I heard down at the Opioid and Heroin Summit was our Surgeon General Murthy, who told us you really need to look at 4 or 5 things in order to fight this problem. That's what we're trying to do here. Number one, if there are any doctors in the audience, I apologize to you now, but we need better prescribing practices. We need to be more careful when we send our kids home after a wisdom tooth extraction or a knee surgery with 60, 70, as many as 100 pills in a bottle. Along with that, we have to have better disposal practices. And right now, through 2 of the grants, we've got a $100,000 grant in the North County and the $400,000 Hal Rogers grant, where we're compiling statistics. It's also given us money for drop boxes. You can't have a drop box at the Shrewsbury PD, the foyer is just too small. But basically, in just about every city in town, and I think we're looking at Walgreens bringing them in as well, we're going to have drop boxes. Number 3, this has to be treated as to what it is. It's not a moral fault. Let me repeat that. It's not a moral fault. It's a chronic illness. With what other disease? With what other medical condition? For example, if you had a heart attack and you came to the hospital, would you ever hear, come back in 3 weeks if you're still alive and we might have a bed for you? We've got to get better with that and recognize that. And the biggest thing there is using compassion. By recognizing that this can happen to anyone, and you heard the principal just give you the numbers in Shrewsbury alone, by recognizing that this can happen to anybody, we can show compassion. Using compassion allows us to get past our biases, to understand that this, again, is not a moral fault, but a chronic illness. It allows us to change our way of thinking and do better. One of the final points, I can go on and on, but one of the final points I make, because I don't want to take too much time, is in 2014, we had 45,000 automobile deaths. And this was suggested by the Surgeon General and President Obama. 45,000 opioid deaths, excuse me. For the first time in history, opioid deaths were larger than our motor vehicle deaths. But think about what happens when we have motor vehicle deaths. There's a helicopter in the air. It's a lead story on the news. We've got the best science brought to the roads, the best engineering brought to the roads, the best science put in the cars. This is what we've got to do with this problem. We've got to bring our best science, our best government and private efforts to this. We've got to find a way to get better. One of the grants I touched on, and I'll end with just to that question, is we've got $100,000 now up in the North County. We partnered with AdCare. When someone overdoses and they come to the hospital, there's immediately an intervention by a loved one, a parent, someone within the family. And we then bring AdCare in. It could be AdCare, it could be Spectrum, it could be whomever. They come, and what we do is we have an opportunity to get people into a bed. We've got money for about 72 beds up there. And what we do is we have that money to actually put someone into a bed and help with the treatment. And just, I said the last thing, but one more thing. With regards to the compassion, we've got to stop looking at this. They asked a group of kids, Give me the 5 worst words for a heroin addict you can think of. Junkie, addict, loser. All right. Now give me your 5 best words. And they all had to pause and they started thinking. Brother, sister, son, daughter. That's how we have to start thinking of the person who's addicted to heroin.
Thank you. So building on that, you talked a little bit about prescription take-back days. I'm gonna move over to Cassandra. Cassandra, can you tell the audience about prescription take-back days, potentially when the next date is? And also, we've heard a lot about, there's twofold question. We've heard a lot about Narcan and what Narcan is. Could you give us an explanation of what Narcan is and potentially how families and members of the community can access that drug?
Thank you. So in central Massachusetts, we've been working with our police departments, our schools, our wonderful DA's office, our treatment providers, and we've really been looking at how can we as the health department support all of the activities that we need to have taking place to reduce the number of deaths that we see and to reduce the amount of addiction and to prevent children from starting to use opioids in the first place. One of the things that we've been doing for several years is sponsoring a medication take-back day with the Shrewsbury Police Department. The one that's coming up for this spring is on Saturday, April 30th from 10 a.m. to 2 p.m. It will be at the Shrewsbury Senior Center. We have flyers on our table out in the lobby. It's so important for people to remove any prescription drugs that could potentially be abused from their home. There are so many ways that young people have come up with for abusing prescription drugs, and a lot of parents don't necessarily think that it's going to happen in their house, but it can happen in anyone's house. It could be your son or daughter, it could be their friends, it could be some other family member who comes over and goes and looks in your medicine cabinet. So we're really looking for people to think about what they have sitting around their house that they're not using, getting it out of the medicine cabinet and disposing of it properly. The other thing to think about is if you have long-term opioids in your house all the time, you should think about getting a lockbox to keep them in, to keep them safe. They're available at most pharmacies. So one of the things that we've also been promoting is the fact that people should think about getting nasal naloxone for themselves to keep on them just in case there's an overdose. You never know who it could be. It could be anyone, anywhere, anytime. It could be your loved one. And it's very easy to use, and it's easy to get in this area as well. So we do have information about where you can get it. In this area, there are 2 places that you can get it for free. So one of them is from AIDS Project Worcester. They have a grant from the State Department of Public Health to provide education for people on how to use nasal naloxone, and then they give those kits out to the people who need them. The other place that people can get it for free is at a Learn to Cope parent support group. Learn to Cope has a meeting every single night of the week somewhere in the state of Massachusetts. In Worcester, there's one every Thursday night. And so we recommend that any parent who may potentially have an issue with their child, go to a Learn to Cope group and find out more. But that's not the only place you can get it. You can also purchase it at Walgreens and CVS pharmacies. So how this works is that the pharmacies of Walgreens and CVS have applied for what's called a standing order to the state. And what that standing order means is that the pharmacy can sell to anyone that walks in the nasal naloxone kit. You do not have to have a prescription. They will have it there, and you can use your insurance card to buy it. From almost every single insurance company is covering the cost of the kit. You may just have to pay your $10 or $20 copay. Some, the Mass Health Insurance covers it, and there's only $2 or $3 copay. So we really promote that people should go out and get this for themselves from the pharmacy. There is no list that you go on. It's actually illegal for the pharmacy and your insurance company to flag you if you purchase nasal naloxone. So it's absolutely out there. It's available for people, and it's very simple to use. We have a kit with us tonight and a flyer a poster at our table about how to use it. But the kit has a couple of pieces. This is the piece that you use to administer it nasally, and then this is the actual medication itself, which inserts into the nasal piece. So there's tons of information out there, and it's a really easy thing to keep on you. And if there's any questions about how you can access it, we would be happy to work with you on that. There's a lot of information at our table.
Great.
Thank you.
Thanks, Cassandra. Welcome, Senator Moore. Thanks for coming tonight. I'm also going to ask and focus my question to Representative Kane and Senator Moore. And I think what I'm curious about is what steps or what things that you've taken part of, or the legislature's taken part of, to help deal with the opioid epidemic, because I know it's been in the news. I know the governor's recently signed a bill, so maybe you can explain some of the steps and some of the work you've done behind the scenes to get that legislation passed, and some of the work you're doing within our communities to address the situation.
Great, thank you. So the Senator and I are going to share the update on what we've done at the state level, and I'm going to provide a little bit of background, and then the Senator will talk about the bill we just passed and the governor signed. I spent a lot of time working on the 2014 gubernatorial campaign, and I spent a lot of time traveling around the state, and I especially worked on events where women were there, and I started hearing every place I was going about this epidemic. And when the governor was sworn in, one of his top priorities was the opioid epidemic. He started by putting together a task force, a working group that went around the state. And some of the reason why this is an epidemic: in 2004, there were 456 individuals who passed away from an overdose in Massachusetts. Since then, 6,600 people have perished. In 2014, there was 1,173 people who died from an overdose, which was a 21% increase from the year before. And as the district attorney said, and to put that into context, in Massachusetts in 2013, there were 371 motor vehicle-related deaths. There was 967 unintentional overdoses, almost tripling. 3 out of 4 communities have experienced at least one death between 2012 and 2014. And in 2014, there were 4.4 million prescriptions for 240 million Schedule 2 and 3 drugs written in Massachusetts. We have 6.2 million people who live in our state. So that would give 40 opiates to every single man, woman, and child living in Massachusetts. And in 2014, here in Shrewsbury, we had 253 individuals who were admitted to state-funded drug treatment programs. 54% of those people were there for heroin addiction, which had doubled in 4 years. So the working group that the governor convened, which included the Attorney General, the Secretary of Health and Human Services, and many people from around the state, they held 4 listening sessions. They held one in Boston, one in Greenfield, Plymouth, and Worcester. The Worcester one was held at Quinsimmon Community College, and many of the people I'm up here with tonight, and some people in the audience were there as well. And for me, it was one of the most moving things I've ever attended. It was an opportunity for anyone to come speak to this working group about what their interaction was with this epidemic. And you had parents, siblings, spouses, children coming forward and telling their stories. Parents who had star athletes who got injured and got hooked to opiates, the prescription painkillers, because the doctor never told the parents there was anything to worry about, or how they might need to step down their child off of painkillers, or what to look for if the child was having altered behavior after being on them for a period of time. You had one mother who stood up to beg that her child be kept in prison because she knew the second her daughter got out, she would go and she would overdose, and she worried that it would kill her. It was really just a moving situation, and everyone who sat in the audience looks exactly like you and I do. So from that, the working group, they met with, they heard from over 1,100 people, and they reviewed academic research, government reports, everything that they could get their hands on, and they came up with several key findings. And essentially, the top 11 things that they found were individuals in crisis couldn't access the right level of treatment at the right time, that youth drug use and addiction trends had to be addressed through prevention education, which wasn't happening enough. The opioid medications must be safely managed by prescribers, pharmacists, and patients, which wasn't happening. That the stigma associated with substance abuse was a major barrier to treatment and recovery. The lack of transparency and accountability hid a lot of what was going on and made us, unfortunately, lag a little bit in recognizing the crisis. That our courts and jails should not be the primary mode of assessing long-term treatment for people who are struggling, and that our resources were just insufficient and difficult to access for recovery. And there's a few others. I was really struck when I was listening to a lot of what they were doing, that 74% of the individuals with a substance use disorder began using at age 17 or younger. So if you're a parent of a middle school or high school child, this is why it's so critical to know what your children are doing, because we can help them cut down on their possibility of becoming addicted. 40% of kids who began drinking before age 15 will become alcoholics. While 81% of parents talk to their kids about the harm of marijuana use, only 16% talk to their kids about the harm of prescription painkillers and using them inappropriately. So we have done several things in Massachusetts. We didn't just start addressing this issue this year. Actually, going back to 2006 was the first time in legislation we created recovery high schools. There are 5 now in the state, including one in Worcester, and I believe that we have 4 Shrewsbury High School students who attend. We also passed legislation in August of 2014 that went into effect in October of this year. It removed prior authorization requirements for outpatient substance abuse treatment. It went from only allowing 3 days in detox to allowing 14 days, which is a monumental difference. It required all insurance carriers to reimburse for substance abuse treatment. Insurance companies had been a major roadblock for people trying to get assistance for their children, and that was one of the things that got taken on in this bill. And then last fall, we passed legislation that was filed by the Attorney General that increased the penalty for possession and distribution of 10 grams or more of fentanyl. Fentanyl is 30 to 50 times more potent than heroin. If somebody takes heroin, which is laced in fentanyl, they're going to die. They're not going to get saved by Narcan, and certainly not by 1 dose of Narcan. It is extremely dangerous, and anyone who saw the Globe this morning probably saw the article on China shipping in pill devices in order for more fentanyl production to happen. Last year, we put more money into the budget for treatment and prevention. And then finally, in January of 2016, the governor signed into law legislation that people had been working on for 30 years. If parents or loved one committed a woman civilly who was having a substance abuse, that woman was being sent to MCI Framingham, a prison. She wasn't getting the treatment she needed. She was getting jail time, even though she had not done anything criminally wrong. It took 30 years and the effort of many, many people Fortunately, the governor signed that into law in January, and so now any woman who's civilly committed and who needs treatment is being sent to Taunton or Shattuck State Hospital. And one of the other things that we're doing right now is we have a campaign to reduce the stigma of this, and it's called State Without Stigma MA. And I would encourage anyone on Facebook who tweets or anything, put it out there and help encourage people that there should not be a stigma to the disease of addiction. It should be treated like any other medical issue that anyone has. I will turn it over now to the senator to carry on.
Thank you. As Representative Kane said, this has been an ongoing issue for many years now, and I think it was 2014 that the governor, former Governor Patrick, declared it the state of emergency regarding this crisis that we're facing. And prior to that time, the tough on crime philosophy was very prevalent throughout the legislature and throughout law enforcement. And it was around this time that we started realizing that this is an illness, it's a sickness, and we have to start addressing it as that. In 2014 was the first substance abuse reform or package legislation that the legislature dealt with, trying to deal with this issue. And then we complemented that this past year with a substance abuse legislation that dealt with treatment, education, and prevention. And some of the aspects of the bill, in the treatment portion, it limits the initial opiate prescriptions to no more than a 7-day supply. We heard a lot of complaints from individuals who had family members who were addicted or sadly had passed away, overdosed from this, coming in talking about how they would have minor surgery or some sort of minor medical procedure, and they would get a prescription for 30 days or 60 days or 90 days. So in this legislation, we limited the 7-day supply, limits all opiate prescriptions for minors to no more than 7-day supply, includes exemptions for patients with pain associated with a cancer diagnosis, chronic pain management, or palliative care. The legislation also provides for substance abuse evaluation within 24 hours of arriving at a hospital or other facility due to an overdose or having been administered Narcan, thank you. Requires prescribers to enter into a written pain management treatment agreement with a patient for long-term or chronic pain management that utilizes an extended release long-acting opiate. Establishes a civil liability protection for the administration of Narcan to those suspected of experiencing an overdose. And it increases transparency in insurance denials to further parity for behavioral health and substance abuse treatment. Those are the main parts of the treatment aspect. Then we also wanted to deal with the education portion of it, which requires all public schools to develop a policy regarding substance use prevention and education. It requires a prescriber to have a conversation with a patient before issuing a prescription for an extended release long-acting opiate in an abuse deterrent form. And I don't know about many of you, but I never knew of this before, that the pill form that can be given out can be made so that it can't be grinded into dust so people can snort it or do other types of, have other sorts of uses with it. So the non-deterrent form is a way of deterring people from using these prescriptions in ways that they shouldn't be. Informs prescribers about opiate prescribing trends, requires pharmacies to give patients pamphlets with specific information about the risk of opiates when filling a prescription for an opiate, mandates additional training about substance use disorders and risks of opiate misuse, including appropriate prescribing amounts prior to a prescriber obtaining or renewing his or her license. It requires medical schools and other health professionals training programs to create a consistent, safe prescribing and pain management curriculum. It also integrates substance use addiction education into high school sports training and driver education programs, and some of the prevention procedures that we have put in the legislation. It empowers patients to request and fill a lesser amount of an opiate prescription. So now if you feel your physician may have given you a prescription that's too great the quantity that you feel you need, when you get this prescription filled, you can ask the pharmacist not to fill it to the levels listed on the prescription. Establishes a 5-year-long drug stewardship program, which would be developed by the Department of Public Health for the collection and disposal of unwanted prescription medications. It also establishes a verbal substance use screening tool for students in public schools, the SBIRTH program, which it's roughly about a 3 to 5 minute evaluation that the public school nurse would sit down with the students, and it would be done twice through the K through 12 grades, 7th to 10th. That would be done where it takes 3 to 5 minutes, and the accuracy on determining someone's potential for being subject to, potential of being addicted to a drug or substance is very high. So it's something that's been used in other parts of the country, and we're hoping that this evaluation will help our schools help identify students who may be at risk of becoming addicted at it before they do. Requires prescribers to check the prescription monitoring program each time a prescription for a narcotic drug in Schedule 2 or 3 schedule is issued. The 2014 legislation that we had passed didn't require it. It was an option for physicians. This actually now requires the physician to check the prescription monitoring program before they give the opiates. It establishes a voluntary non-opiate directive form to indicate that an individual is not to be administered nor offered a prescription for an opiate, and it establishes a commission to increase the patient access to the full spectrum of pain management options. I think the toughest part that we had with the legislation, both times that we passed it, was really changing the mindset of a lot of different groups who were involved in this issue, that this is a sickness, it's an illness. No one grows up wanting to be an addict and addicted to some sort of narcotic or substance. And getting the various insurance companies, the physicians on board, I think was at times some of the hardest parts that we had in this legislation, getting them to realize that if we were going to conquer this, it had to be a group effort, and it wasn't just going to be by a legislative measure or a law enforcement initiative, that everyone really had to work together. Thank you.
Great. So, Senator Moore, you touched upon the healthcare situation. I'm going to ask Mr. Faris a question now regarding your role in Spectrum Health Systems, and what I'm curious about, and the people that I've talked to are curious. What's that look like? What do you see, and what's it look like when someone comes to your organization and asks for assistance? And maybe share some insight of your years of experience of what you're seeing now relative to the current epidemic.
Sure, thank you. And I thank you all for turning out here tonight. This is probably one of the best turnouts we've seen. We've been participating in a number of these, myself on one staff, a number of these all around central Massachusetts and outside. And this is an excellent turnout, so I applaud you for that. Before I get into my remarks, I would like to make one remark, and then I'm going to come back to it at the end, that if you care anything about what you're hearing about here tonight, and obviously you came here, took the time out of your day, your evening to come hear us. If you care anything about this at all, is that when the marijuana ballot question comes up in November, please do not vote for it. And I'll come back to that towards the end of my comments. Spectrum's been in operation going on 46 years now. And we've always been very heavily weighted towards the opiate side of things. We've always treated people for all forms of addiction, whether it be opiates or alcohol or prescription medication or hallucinogens or amphetamines or whatever the case may be. It's all the same type of behavior. In probably the last 10 years, we've seen the demographics of the people admitted into our treatment programs change dramatically, and it's continuing to change. where for many years we would see the average age pretty much stayed around 30, early 30s for the longest period of time, probably 60, 40% male, female. In about the last 10 years, that demographic has been changing dramatically, where it's coming down now to predominantly in the 18 to 26-year-old group. They're primarily white, they're primarily suburban, they're educated, they're upper middle class, right? And there's all a very similar trend here, where they all may have been drinking, or maybe there was some marijuana involved. Usually there's some marijuana involved. But then something would happen along the way where they get introduced to medication, either through a friend or through an injury. And who thinks a problem? It's a pill. What's the big deal? It's only a pill. And then it goes from there, and before you know it, the pills become too expensive, and they're led down to the street of dealing with heroin, which is right now probably costs about similar to a cost of a pack of cigarettes. And the quality is very good, by the way. These people that sell heroin on the street are good businessmen, and they know that how you compete is based on price and quality. This has become more and more of a recognized problem, and the fact that so many of you would turn out here, as well in some of the other communities we've seen people turn out, is because it's impacting people in this room. It's not because you're just curious. Maybe you are, but I think for most people, there isn't a family who hasn't had somebody who's been touched on by an addiction problem in the last 10 years or so. And it's becoming more and more high profiled, and I'll give you a couple examples of that. About a year and a half or so ago, one of my staff, we have a treatment campus over here in Westboro with about 240 beds at 4 different levels of care. And one of the staff over there was telling me that about a year and a half ago, they admitted a young woman into one of our programs over there. I think she was in her late teens, early 20s. And in less than an hour or so, she came back to her counselor, and she was very upset because she recognized one of the other women that was in the treatment program there as her former soccer coach. Now here's this young woman who's coming in here to treatment, and she recognizes someone else in here was her former soccer coach. You can imagine how the soccer coach must have felt. Another point you might have noticed is that during the Super Bowl, I don't know if you noticed this or not, but there was an advertisement for people that are receiving medication for an opiate addiction problem. If they're suffering constipation, there's a medication to address that. Now this is at the Super Bowl. Think about that. So if someone is getting medication to deal with their addiction problem, whether it be methadone or Suboxone or Vivitrol, and they happen to be suffering from constipation as a side effect, now we're advertising a medication to address that at the Super Bowl. I'm not saying that's a bad thing, but I'm saying that this is the level of which this problem has risen to, all right? I want to reiterate very much what Joe was saying. This is not a disease of shame. Too many families sit back and they're embarrassed, they're full of self-pity or anger or confusion because they don't know how this could have happened to them, all right? It is not a reflection on you, believe me. It's a sign of the times, it's the prevalence of the problem that's out there, all right? And everybody has to step up and do something about it. There are a lot of groups out there. Cassandra mentioned Learn to Cope. Certainly please reach out to them. They're people just like everybody else who've had someone with an addiction problem. We've been growing lately at Spectrum quite a bit on our outpatient site. We're up to about 11 outpatient facilities now across the state. We've got the 240 beds here in Westboro. We have another 60 down in Weymouth. We do operate in 5 other states on both coasts. We're very fortunate in this state that we're able to have the type of leadership that we have here in Massachusetts, from the governor's office to the attorney general to the legislature, and right on down to the local level with Joe Early and his efforts. We don't see that in some of the other states that we operate in. They've taken charge of this issue and taken some very bold steps. And I keep telling people, I've been saying this quite a bit lately, I've been at this my entire career, and I've seen more done to address this issue in the last 14 to 15 months than I've seen done in the last 10 years. And there's more to be done. It's not, it didn't get this way overnight, it's not gonna turn around overnight. But, you know, the governor and the attorney general and the legislators can pass legislation and employ regulations and everything else, but they can't step into your house and do anything about that, or into your neighborhoods, or into your schools. You have to step up and address that, all right? If you see a small symptom, it's usually indicative that there's something else here. These symptoms, there's not a rite of passage, as one parent tried to tell one of our staff. This is not a rite of passage. People are dying. There was an article in one of the newspapers over the weekend, Middlesex County, which is suffering from the highest level of opiate overdoses in the entire state on a per capita basis, saw a tremendous explosion over the first quarter of this year. All right, of people, fatal and non-fatal overdoses. It's a tremendous strain on the first responder community, right? And it's continuing to escalate, but you have to step up and recognize it and do something about it. You can't ignore it. Ignoring it is the worst thing you can do, all right? And don't think that just because a kid is 14 or 15 or 16 years old, that they're not slick enough or smart enough or sly enough or manipulative enough to find out how to get it. They know how to get these things. They know who's hurt and who's going to get a medication. They know who's going to the dentist and who's going to get a script, and they start cultivating them ahead of time. Before I close, I would like to come back to the marijuana issue. All right? This is going to be on the ballot. There'll be a ballot question coming up this November to legalize a recreational use of marijuana. And I'm going to say, if you care about anything you hear here tonight, do not vote for that. Do not vote to legalize marijuana. You will hear the comments you'll hear them all, because we've always heard them ad infinitum. Oh, it's only marijuana. People smoke it in anyway, so we might as well get some tax revenue out of it. We shouldn't be sending people to jail for marijuana. I don't think we send anybody to jail for marijuana, Joe, do we? Sorry? We don't send anybody to jail for marijuana, do we? Unless you get a car.
We never have, and we never would. Since you brought it real quickly, the senator can tell you, the rep can tell you, and I applaud the governor, lieutenant governor, the rep, the senator for the leadership on this issue. But the one thing, all the addiction people in Denver have told us, do not do it. Do not do it. It should not your mom and pop's marijuana. They're putting it in forms now like the THC and gummy bears. They're putting it in brownies. Who's that aiming to get to? It's the children. If you legalize it, you're basically telling kids between the ages of 16 and 21 it's okay to smoke pot. And what we know is that it reduces IQ by 7 to 9%, and it is a motivation killer, and those effects are irreversible. Not everyone who smokes pot is going to use heroin, but everyone that I have met who is a heroin addict or an opioid addict has smoked pot at some point in their lives.
Thank you. So again, please take this very seriously. Don't be deceived by some of the propaganda you're going to be hearing. If you do have any concerns around this opiate issue, someone in your family have any suspicions, things you don't think your son, your daughter, your family member is being truthful with you about, there are plenty of places you can call. Feel free to call us at Spectrum. Some of the resources that Cassandra mentioned, some of the resources that have tables out here. Do not hesitate and think it'll just go away. It will not go away. That's the biggest thing you can do. Does that mean? The worst thing you can do is just think that it's going to go away. All right, it's not going to go away. It's going to snowball. That's why we've got this problem here in the Commonwealth, because nobody took charge of it years ago. Thank you.
So, Mr. Faris, I know Senator Moore took a trip out to Colorado and served as one of the legislators from the state to take a look at the Colorado dispensary stuff and the medical marijuana and recreational marijuana. And I know you talked about this. So I'm going to delay asking my question to Lieutenant Lonchiadis and come to you and maybe talk a little bit about what you saw and piggyback on Mr. Faris' comments.
Thank you. Yeah, when we went to Colorado, there were 8 of us that went there, and we spoke with everyone from the administration, public health, law enforcement, and the common theme we heard here was treat it like alcohol, tax it, regulate it, and use the money to fund education, use it for other sorts of programs. The tax revenue does not come in, that's estimated to come in. The cost of government increases. The Department of Agriculture in that state is looking at a 2.5 to 3 times doubling of their budget. Law enforcement costs have also gone up. They have issue with, instead of operating under the influence of alcohol, you have drugged driving issues now with people driving under the influence of marijuana use. And then they have the problem with trying to prevent it, deter people from it, and identifying the actual use of it when people are operating it. The long-term use, as the DA said, there's actually a 7 to 8 to 9% documented reduction in people's IQ. The potency of it. 30 years ago, it was roughly 3% what was being smoked. Now, you're looking at 18 to 19% potency. The potency in the edibles, up to 80 to 90%. And it takes 2 hours for the body to actually go through the body and get digested. So what you're having is you're having medical emergencies taking place where individuals are having a cookie, or they're having a lollipop or a gummy bear. 15 minutes go by, they don't feel the high, so they have some more. They still don't feel it after a while, then they have some more of it. Next thing you know, you've got a medical situation where they're overdosing from the use of the recreational marijuana, the THC. And then the other issue we had out there, everyone's got different data. You talk to the industry, and that's what this is about. This is an industry. This is the $5 billion industry that's going to come here in the next few months, and it's going to take over the airwaves and the media trying to promote this product. They talk about there's only a 1% increase in the amount of people going to the emergency rooms. But what they don't tell you is that 1% is actually not 4,000 people, it's 8,000. So it's a doubling of people going to the emergency rooms related to these types of incidences.
So Senator Moore, I think,
Okay,
I don't
so
want
I
to
just
get too
want to
much off
reiterate that,
topic.
agree with Chuck and the DA. This is a bad move policy-wise, and I would just ask you, please, when you see the commercials, just look more into this, because it's not good for Massachusetts.
Thank you. Lieutenant Lonchiadis, can you bring it back to our community, local community? What is the police force and our police department seeing with our community, and some of the things that you're dealing with, and how do you maybe help support people that are suffering from addiction?
Sure. So over the last 2 years or so, we've seen an increase in the prevalence of opioids, more specifically heroin. Its potency has increased, its cost has gone down. So as a result, we end up seeing more opioid or heroin overdoses. But because of Narcan, we've actually seen a decrease in the deaths as a result. We go to more overdoses, but we're not seeing as many deaths because more times than none, Narcan is being administered. So as far as crimes go related to that, generally you see house breaks, car breaks, and shoplifting are the crimes that are affiliated with this type of addiction. Shrewsbury's actually seen a decrease in house breaks, an increase in car breaks, but I would say that those crimes are usually crimes of opportunity. So people are doing a better job of securing their homes, but believe me when I tell you, if you leave the car unlocked, that's what they'll do. They just want to get something of value and try to sell it and get some money to go buy some drugs. So, and as far as shoplifting goes, it's probably stayed about the same. We haven't seen an increase or a decrease there. Probably, we're not really set up to be preventative. We're more, we do what we have to do and enforce the law, but I want everyone to understand that. I know they look at the police and they think that, yep, you're there to put them in jail, arrest them, put them in jail. Not with this epidemic. I would speak from Chief Hester all the way down to every police officer in town of Shrewsbury. We understand that that's not going to fix this problem. Arresting people is not curing this problem. And I would also reiterate what District Attorney Early said, and just show compassion. And trust me when I tell you that the Shrewsbury Police Department is doing that. So again, we're not suited to rehabilitate, but our role is changing now because of this. We find ourselves assisting a lot of families in trying to find help with their situation. And we usually assist them by, there's a Section 35, which people have the opportunity, some of you may be familiar with it. It's what family members can do to get their loved one help in these situations, and it's basically court-mandated help. So you can come to the Shrewsbury Police Department. We will help anybody with that. It is available to most people to try and resolve, the situation that you're going through. And we do see a lot, we feel compassion for the family members, because that's who I really deal with, is the actual family members come to me and they're in a bad situation and they just want help. So we generally steer them to the court for the Section 35 or to one of these other agencies up here at the table. The most preventative thing that we do offer is what Cassandra spoke about, is the drug take-back. It's very successful in the town of Shrewsbury. I've personally run it since 2013. We do it twice a year, once in the spring, once in the fall. The first year I did it, I believe we took in almost 500 pounds of prescription drugs in one day in the town of Shrewsbury. So we were the highest in Central Mass when I turned that in. So, and people were so relieved and so thankful to have an opportunity to give us these drugs and to properly dispose of them, because they've been told not to flush them down the toilet because of the water system. They didn't know what to do with them, so they brought them to us, and it's been very successful, and we're going to continue to do that. Again, April 30th, Saturday at the Senior Center, we're holding our next one. And then the other thing we do is just to stay in touch with these people up here. We're members of SCAPE. We're also members of the Massachusetts Opioid Abuse Prevention Collaborative Effort. So we stay in touch with everybody up here. We work closely with them, and we offer any assistance we can to try and alleviate this horrible epidemic.
Great, thanks, Lieutenant. I'm going to turn it over to Joey to give us, Joey Cameron, to give us an idea about your situation, maybe tell a little bit about your story, how you came upon addiction, and maybe a little bit about your recovery and what you're doing now.
Yeah, absolutely. I will. I just want to take a moment and, just recognize, this opiate panel, and just let everyone know how blessed we are to be a part of this, because, I'm looking around the audience and I see some faces in here that really remind me of my mom and dad and how they looked. And, my mom is here right now, and, I've never seen her more happy in the past, 3.5 years, that I've been doing this. And, when I was doing this for the better part of 10 years, she didn't have these panels. Like, she didn't have, really anybody, to help her. I'd like to thank DA Early and, all the ladies at your front office who are great. I feel like I talk to them, every week about, different resource tables, State Rep Kane and everyone else on this panel. Yeah, I guess, how I'm going to do it is I'm going to share what it was like, what happened, and what it's like now, and I'll try to do it in like 5 or 7 minutes, which is going to be a little bit tough. I could go all night. Yeah, so basically, I grew up in, I didn't grow up in Shrewsbury. I grew up in Southborough, like right down the street. And, I had a pretty average, not an average childhood. I had a great childhood. My parents did like everything they could for me. I had every opportunity, and opportunities that a lot of people don't get. My childhood, I'm an only child, so my friends were like a big part of, my life from early on. Like early on, and you mentioned it, in the beginning, that you see a lot of addicts like wanting to be cool or fitting in, or anxieties. And I can remember early on, like that was my biggest thing. Like I wanted to be cool, whatever like the older kids or the cool kids were doing, like I wanted to do it. If they told me to wear like a, pink dress to school, I would have done it if that meant I was cool. So growing up, that carried over, into high school. Sports was a big thing for me. I played varsity lacrosse, I played hockey, and again, it's always looking up to the older kids, it's always trying to fit in. And, it holds true to me, my first experience with prescription painkillers was when I got my wisdom teeth out. I got a whole bottle of, Percocet, and it was gone, within the first week, and it was a month's supply. And that was like really the first part of everyone in our school. Like we all started to do that, and we all figured out who was getting their wisdom teeth out, who was having a prescription, all of that. That was really like the first prescription, addict behavior we were doing. High school was pretty standard. It was we drank, we smoked weed, and obviously it progressed. It snowballed, like someone said earlier. So basically, I went off to college like everyone does. You know, I didn't really know what I wanted to do. I went up to Plymouth State and I played lacrosse, and you know, very quickly, you know, the innocence and doing drugs and partying really turned into a necessity. You know, I started to change my behaviors. I started to, you know, switch who I was hanging out with. I, you know, very quickly realized that partying and doing drugs and getting high was more important to me than doing school and doing sports. So yeah, basically, somehow I got really good grades at Plymouth, and then I ended up going to Clemson University. Excuse me. I transferred down to Clemson University, and all the freedoms I had in college, like you don't have in high school, you're going to be around people who are ready to, you know, party all the time. So that freedom going from, you know, mom and dad, you know, being with mom and dad every night, having dinner, and, you know, having to go to bed and go to high school the next day, and breaking all those freedoms, or getting all those freedoms going to college, and, you know, not having really any rules, and I just wasn't prepared for it, you know. I was an 18-year-old kid. I didn't really know what I was doing. I somehow got good grades at Plymouth, even though, you know, I was partying and doing drugs every single night. I transferred down to Clemson because I thought, you know, a geographic change is going to fix everything. And all that did really was, you know, make things worse. You know, instead of being, you know, 2 hours from home, I was 1,500 miles away. You know, no one knew what I was doing. You know, the only time people saw me was like winter break or Thanksgiving break, and, you know, you pretend like everything's good, and like, yeah, I'm getting straight A's, this and that, and like really I'm just like, you know, a heroin addict, and you know, things are getting really bad, and I'm seeing all my peers around me like getting internships and getting jobs and like getting like dean's lists, and, you know, every part of me wanted to do all that, and for whatever reason, I just, you know, I couldn't, and I was just different, and I didn't know why, and, you know, I was in denial, and I'm sure my parents were in denial for a while of, you know, why their son was like this, but, you know, it took a lot of years because we didn't have, you know, resources like you guys have today. So yeah, basically I did what I could at Clemson, and, you know, I ended up taking a medical withdrawal my last semester of senior year. Literally, like, I couldn't even leave my, you know, I lived in the fraternity house, I couldn't even leave my bed, you know, without shooting heroin or taking Xanax or whatever I was doing at the time. I ended up taking that medical leave, and I came back to, you know, Massachusetts. I came back to the state, and that was right when, you know, OxyContin was getting like huge in mass. It was actually like a little after. It was, you know, OxyContin was very prevalent. It was really cheap at the time. There was, you know, a lot to go around, and then, you know, all of a sudden overnight it just disappeared, it seemed like, and that's when the whole shift from, you know, pills and painkillers really just moved to heroin. And when you're an addict and you're you know, you don't care, like, you don't care about the stigma, you don't care that, like, you know, you're just so delusional. Like, I thought, like, if you didn't shoot heroin, like, there was something wrong with you. You know what I'm saying? So eventually, you know, I was in Boston, I was running around, and, you know, I came back to Southborough, and I came back to Central Mass, and I got further and further away from, you know, the people I grew up with, and everyone knew there was something wrong, but, you know, I was at the point, like, I couldn't get help. Or I would go, and I'd go to detox on the Cape, or I'd go to a treatment center, and it just didn't really work for me. You know, I knew too many people around here. You know, I knew people in New Hampshire, I knew people in Vermont, I knew people in Connecticut. Like, nothing worked for me. And it wasn't really until, you know, my mom and dad kind of just like told me, you know, we love you, but we can't do this anymore. And that really, like, when you're an only child, and like, you know, mom and dad is in like your back pocket all the time, no matter what, you know, when they tell you, you know, they block your number and they change the, you know, garage door code and put all your clothes in the front door, you know something's up, you know, it's time to make a change. So luckily I was blessed with the opportunity to get out of the state and go down to, you know, Florida for treatment, in South Florida. You know, treatment, it didn't work right away for me. I had to do it twice, but the second time I went down there, I listened to all the suggestions and I kind of ran with it. My sobriety date is December 12th, 2012. So I just celebrated 3 years a little bit ago. And down in Florida, that's really kind of where I thrived, and I still live there today, and I work in treatment. But for young people, like I said, I grew up I needed to be cool, and AA around here just wasn't really for me. It was in the basement of churches with people that were 100 years old, and you're an 18-year-old kid, and you're I'm not like you, So down in Florida, the young people in the recovery community, it's attractive. You see young men, that have their lives back, that are sons, to their mom and dad, that are, brothers to their sisters, that work, that graduated college, that, are doing all these amazing things that you truly wanted to do this whole time, but, you had this addiction problem that wasn't letting you do it. And you see that it is possible, because around here, I didn't see it work for many people. And once you're down there and I saw it was possible, I bought into it, and I bought into what they were doing. And, I work a 12-step program of Alcoholics Anonymous today. I sponsor guys, I bring them through the book. Basically that was really, my story. Florida basically saved my life, and, I love to come back here and help any way I can. It's weird, even 3.5 years later, flying in a Logan and getting off, and driving down the Mass Pike, all those memories still come back, and they hit me, but, I'm able to, look at where I'm at today and, how far I've come, and, it's just a beautiful thing to be able to give back and help other people, so.
Great. Thanks for sharing your story. So, Christine, you have the difficult task here of kind of wrapping up the panel, and I think Christine and I go way back. I had all her kids come through the school, so I'm familiar with all her kids. She has fantastic kids. She has a fantastic family. But Christine had her struggles within her family, and it was difficult. We had a number of conversations over the course of their time here addressing someone in their family. So I'm going to let Christine talk about what happened and the impact addiction might have had on their family. Maybe you could share some of your experiences there.
Yeah, sure. No pressure or anything. Give me the wrap up.
I'll wrap up for you.
So I'm very encouraged by the number of people here, and also very encouraged by the panel. Like Joey was saying, when our son began his substance issues, it was probably about 10 years ago, when he was around 15 years old, and there were not the resources nor the awareness around opiate abuse. We knew that he was using substances, definitely drinking, probably marijuana, but we had no idea that he was using heroin, none. It was a blindsiding experience to find out that our son was a heroin addict. And it took us many, many years, many years of adjusting to this knowledge. We immediately tried getting him treatment. I'm familiar with Spectrum. I'm familiar with AdCare. I'm familiar with McLean Hospital. We took him to every psychiatrist that specialized in treatment. It's very, very difficult to get a teenager seen. Any of you in the audience who have teenagers who are either experiencing mental health issues, which are often comorbid with substance abuse and dependency. Psychiatrists don't often see, or don't always, I should say, see teenagers. It's very difficult to get them seen. And the other roadblock to our helping our son was the fact that at age 17 in this state, I think it's still true, they can make their own medical decisions. So just think about that for a minute. At age 17, they can sign themselves out of any bed you get for them. Not only can they sign themselves out of any bed that you get for them, but they don't even have to tell you that your child is there. So as you're worried
about whether or not your child actually made it to McLean or made it to AdCare or is staying in the detox, personnel there aren't allowed to share that information with you because of HIPAA laws. So the impact that it has had on our family has been, it's been devastating. It's a devastating experience. We've experienced the stigma, not necessarily stigma from friends who were very supportive, but it was a very isolating experience to not have anyone to talk to about it. As time went on, we realized that it wasn't just our son who was suffering. It was the family across the street, and I mean literally across the street, who had 2 children involved. There was the family next door to us who had a daughter who was struggling with the same issue. Friends on my son's hockey team are part of those figures of those kids who passed away. So it's very, very close to our family's experience. It's a lifelong struggle, and I'm sure that anyone who's recovering can tell you. Relapse is very common, incredibly common with opiates. And so there's that constant fear of wondering if your child is going to actually stay clean for longer than a few months at a time. So I guess what I would encourage you to do is a couple of things. First of all, I agree with what one of the first speakers said, was we need to look at this with compassion and look at someone who has a dependency problem, not that they have a character flaw, but that they have something that they're struggling with. And then also, I would encourage you to think about the kind of mental health issues that might be in your family, because sometimes there's extra risk factors. So if someone in your family has a mood disorder or an anxiety disorder, even if they've never been diagnosed with it, it's important to talk about that as you're making your kids aware of the kinds of issues that might be involved if they begin smoking marijuana or if they begin drinking. There should also be a conversation about how that is related to them self-medicating around anxiety issues or self-medicating around depression issues. And so not only do we need to bring substance abuse out of the darkness, but we need to bring mental health as a whole out of the darkness and begin to have honest conversations. There is mood disorders in my extended family. There are dependency problems in our extended family. And we're a big Irish family. And no one ever talks about the fact that, that grandpa had a dependency problem. He just, according to my family, he just, liked his beer. So I guess that's what I would leave you with. And thank you for your attention and your support.
Thanks, Christine.
And that's about all.
So before we have a question and answer session, I just want to share a couple things that I see as a high school principal and administrator, and my assistant principal see this as well, is there's a couple things that have changed in terms of our upbringing. We didn't have the internet. That's the first problem. We didn't have cell phones. So a lot of the communication, I call it clandestine communication, it's all secret. I'm not sure how you manage that within your own house, but text messaging and all that stuff, you have to try and, we have contracts with my kids at home around the phone's mine, and I can look at everything that you see, and if you don't want to share it with me, it's not going to be yours. You won't have a phone. That's a really important thing. There's no longer that phone in the kitchen where you ask mom and dad to get a longer cord so you might be able to steal away and have a conversation with a girl of your, or a boy of your desires. Clandestine communication is one of those things. Disposable income, the panel talked about this. We're a community ripe with disposable income. I always say, if you give your kids $20 a week or $20 a day, sometimes we had a parent that said to me, I'm giving $10 or $15 every day, and I added up, and it's about $150, $200 a week. It's a red flag. I hate to say it, it sounds maybe over-parenting. Ask for receipts. $20 here, what are you going to buy it on? Give me the change back. You have to pay attention to the money that's going out. It's easy to do. We all want to give our kids money to go get pizza, to go get a sandwich, to be with their friends, to go skating, whatever they want to do. But the reality is disposable income is so dangerous. We talked about this change in behavior and change in friends. I think Joey and Christine can attest to this. We had significant change in behavior and change in friends. It's a red flag. And I always go back to, it's mother's intuition. If you think something's wrong, something's wrong. And you have to continue to press to ask questions and sit down and have a conversation with your kids, which is harder and harder because they're so connected to their devices, but you have to find time to sit down and have a conversation with them. And last but certainly not least, and again, it sounds like over-parenting, but when you have surgeries or injuries and there's pain medication within your house, you have to make sure that you count that and you administer it with the person and then put it away. You can't trust, and I hate to say this, it's about trust, but you don't want to leave that opportunity for your children. It's almost like, we'll take this together, and here you go, here's your Percocet because you had wisdom teeth out. Let's see if we can get through maybe one today and turn that stuff in back for the drug buyback days. Your kids know what's happening in their community much better than you do. And I think sitting down with them and having a conversation is a really important step in helping us achieve some of the goals around the legislation and whatnot. But I think parent communication is really important. So, that being said, I hope that we can have a positive impact upon what we're seeing in our community. I want to thank everyone for turning out, but I want to open the floor for anyone that has any questions. There's 2 microphones in the aisles. If you have any questions for any of the panelists or want to make a comment, we'd be happy to have you come up, and we'll wrap up in a few minutes.